the microscope, it looks innocent enough, but scientists who study it know differently. You're looking at the deadly Ebola virus. And tonight, a man in Dallas fights for life as the first case of Ebola in the U.S. makes headlines. That hospital just 250 miles from Tulsa. And with that in mind, should you be concerned? As part of team coverage, we answered that question in just a moment. First, though, as the story was breaking during 2 News at 5, we told you a man who traveled from West Africa to Dallas got sick on Sunday. Today, confirmation came that it is Ebola. And new since 5, we've learned the CDC is not worried for those who were on the plane with him because he showed no symptoms at that time. Still, the CDC has one lingering concern.
It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks.
At this hour, the CDC does not believe there are any other cases in Texas. Now, the big question on many minds tonight, should the general public be worried now that Ebola is here in the U.S. and so close to home? 2 News reporter Nathan Edwards in the Update Center tonight with that part of our team coverage. Nathan?
Well, right now, health specialists tell me that Ebola is not a threat in green country, but they have a plan in place if a case ever turns up here.
This checklist from the CDC highlights a step-by-step process on how to deal with an Ebola patient, a list that is being reviewed by health agencies throughout the region after hearing the news out of Texas.
We are monitoring the situation very carefully, and we know how to respond if it does happen to us.
Today, Tulsa's health department is reviewing their action plan and making sure hospitals do the same. Things like knowing the symptoms and how to isolate an infected patient from others.
We want people in the United States to realize that it's not an airborne disease. This is something that we are doing contact monitoring on, and it's a very, very low risk for people in the nation.
At this point, health specialists say we just need to stay calm.
If you're in Tulsa and have not been in West Africa anytime recently, there's no chance that it's Ebola.
Because it appears that doctors in Dallas have isolated the disease.
It's obviously not a good thing that it's shown up in our country. However, we know how it's spread. We know how it's transmitted. We know how to stop it from being transmitted. And because of that, we can prevent an epidemic from occurring.
And our risk remains low.
Right now, we're looking at a very minimal risk for the community.
Well, the CDC says that anyone that has had contact with the infected patient in Dallas will be watched for the next 3 weeks. That is done simply as a precautionary measure to make sure it doesn't spread. Reporting in the Update Center, Nathan Edwards, 2 News works for you.
Thank you, Nathan. 2 News working to make you aware of just how Ebola spreads. It is not easy to catch. First, the person must show signs of illness, and that's why those on the plane with the man in Dallas are in no danger. As the illness progresses, the more infectious the person becomes. Transmission is only possible through bodily fluids, which includes something as simple as sweat. Now, the virus cannot travel through the air like the flu. As soon as this story broke, 2 News sent out a mobile